for me.
Okay. So, good morning. I hope you're doing well. We're going to discuss strategic marketing plan in healthcare. So, we'll need to know what strategic marketing is in healthcare settings, and then we also need to know how the marketing decisions are made, what factors influence the marketing strategies being employed in healthcare organizations. We will also look at uh, the tools that we can use uh, to, to gather data in order to make these decisions. Okay, so the tools that we use for market research, segmentation, targeting, positioning, and then differentiation. And then finally, we'll look at how to develop these marketing strategies and plans. So how these plans actually look like. So those are the things that we are going to look at. Okay, so a marketing plan is actually very, very key in a healthcare organization because it is this plan that we can really strategically place the organization or the health organization in a situation where it can have competitive advantage. Okay, so this can only happen if we really take deliberate steps in forming this marketing plan or in developing this marketing plan. So what are the steps that you can really follow in making this strategic marketing plan? So one, you need to analyze the institution's image and mission. And it's for every plan that you're going to make, it should be in line with the institutional image and its mission. Then you do what we call market analysis, positioning, marketing mix, implementation, and then evaluation or the evaluation plan. So those are the things that you will have to follow in coming up with this plan. So we are going to look at each of these plans and we'll be expanding on each of these steps that we have seen here. So basically, we are going to look at each of these as we go. So first of all, when we talk about the mission, we are basically talking about a clear and a concise statement that defines the fundamental purpose, core values, and the primary objectives of an organization or an entity. A mission serves as a guiding principle that articulates the reason for an organization's existence and outlines what it aims to achieve in the long term. Okay, so having the mission in mind is very, very important in the planning process for marketing. So you need to know what the organization stands for, what it intends to achieve in a long term, okay, and what are the values that guide its operation. Those are the things that you really need to look at. If you have an organization, for example, that has a mission statement like this one, to provide compassionate, high quality healthcare services that improve the well-being of our patients and the communities we serve. We are committed to delivering exceptional patient care with integrity, innovation, and a dedication to continuous improvement, while always putting the needs and the comfort of our patients first. Our mission is to be a trusted partner in health thriving for excellence in medical expertise, patient care, patient safety, and personalized care. So this is an example of a mission statement for a hospital. So you will see that this mission statement has key values that are very important in the provision of services in this hospital. Issues to do with high quality healthcare services. That means that you don't create room for substandard work. Okay? Components to do with integrity. You can see that. Innovation. And then a dedication to continuous improvement. This is making sure that there is a culture in an organization to always improve on how services are being delivered, learning from mistakes, and having processes in place for how healthcare delivery can be improved. The other element that you can see is what you call putting the patients first. This is basically a patient-centered approach, always putting the needs and the comfort of our patients first. That is very important in this mission. So when you understand this kind of mission statement, the uniqueness for which an organization was established, and what values it espouses, these are very, very important in the operations and strategic planning for the organization. So that's why you need to look at that before you start to look at the marketing plan. Then we go to the image. Okay, you want people to have a very good perception about the services, the products that you actually offer to the market. If you have a very good reputation, it is very possible for clients to trust you, and you have a high potential of attracting new clients. Okay, so how do you maintain that image? By providing high quality services, okay, at a reasonable cost, okay, and also making sure that the patients are actually satisfied with the services that you're offering. Okay, so therefore, when you deliberately position yourself and making sure that you have strategies in place to provide high quality services and to meet the demands of the patients, then you are going to have a good image. Okay, a good image is actually very, very important in healthcare industry. You need to have a hospital that is responsive and always striving to meet the needs and even exceed the expectations of the clients that it serves. Making sure that there are strategies that can avoid that can reduce or even eliminate errors. Strategies to always solve the problems when they arise. So you need to look at the image and the mission from the one go. The other thing that you really need to do is to understand the market or the market where the hospital is located, or where the health organization is actually serving. So for you to understand that external market or external environment, you need to do a market analysis. So there are very many models or frameworks that you can use to understand the market environment. Okay, so you have PESTEL analysis, you have SWOT analysis, you have Porter's 5 forces, you have market segmentation, and then you have market research surveys. So we're going to look at each of these. So starting with PESTEL, which is basically a model that can be used to understand the external environment in which the hospital is working in. And then after understanding all this external environment, you can now decide on what strategies the hospital can implement. Okay, so the hospital does not operate in isolation. The things that are happening, whether social, whether political, whether economic, whether legal, whether ecological, they all affect the operation of healthcare organizations. Okay, so using PESTEL, we can be able to analyze these factors and then be able to influence the direction that the hospital will take. So PESTEL is basically standing for P standing for political, E standing for economic, and then S standing for social culture, and then T standing for technological, and then E standing for ecological, and then L standing for legal. So when we talk about the political environment, we are referring to the fact that the political climate or the political situation of any country will always affect the healthcare industry. The governance issues, the process of forming and even changing laws, the government policies on establishment of healthcare organizations, all these have an impact on the healthcare organizations. If we have unstable political environment, no investors will actually come in. Okay, if you don't have a favorable tax regime, this is to say that if I want to establish a hospital, the taxes that I have to pay are huge. That also makes it extremely very difficult. So even issues to do with employees, employment law, for example, in our country we call it the labor law. Okay, how easily can you employ people or health workers? Okay, what are the regulations that you really have to follow? Do you want to have international staff, experts, and if they have to come into the country, how easy is it to get the work permit? Okay, and what is the cost of that work permit? Okay, so that means that if you're going to employ experts, you need to look at the employment or the labor law and see whether it is actually making a business sense for you to employ experts or even locals or nationals. Okay, so that is the political angle to it. Basically, politics affects the political environment affects almost every field. Okay, so it is very, very, very important that that you understand the law. But if you're also, the political environment. But if you're also a politician, you should be aware that it is very important to create a conducive and supportive environment, and that is when you can have investors coming. Then we have to the economic situation. This relates to many things. One, foreign exchange. Two, forex rate. Okay, which is basically foreign exchange or the forex rate. These are the same things. But also very important is the inflation. Okay, issues to do with whether the citizens are really having money to be able to purchase services. Okay, you cannot build a high-end hospital in a place where the people staying in that community are low income earners. Okay, so now what is the purchasing power? Okay, purchasing power of the what? Of the customers. Okay, so that is very, very important. But the other factor also, apart from the forex rates, the inflation, the level of unemployment, it's also very important to look at the ability to get loans. Okay, the ability to get loans. The ability to get loans, of course, is related to the collateral, that is, or the mortgage. If you want to get 10 million South Sudan pounds, how much do you have to pay how much do you have to give in as the mortgage? Okay, and what is the process? Is the process a tedious one? It is very easy for you to get 10 million South Sudanese pounds. Okay, so that is about the mortgage. The other thing that you need to look at is the interest rate. Okay, how much are you going to be paying, or the rate at which you pay back? Is it at 10% per annum, or is it 5% per annum? You need to look at those dynamics. Okay, so that is the economic environment. So if you're going to establish a hospital or healthcare organizations, you need to look at the economic environment. And then you look at the social-cultural dynamics. In this, you're looking at the patient choice, changing expectations, demographics, and how they impact on the healthcare organization. Okay, usually hospitals, high-end hospitals will attract high-end social classes or higher social classes. And then you look at T, which is basically technology. Technology is very, very important in healthcare organizations. New technologies or deploying new technologies is associated with improving many things. One, it improves patient satisfaction, improves effectiveness, improves efficiency, convenience. Okay, so the healthcare organization that you're starting must adopt some of these technologies to do with medical records, technologies to do with imaging, painless diagnostic procedures. These are things that you need to look at. And then ecological is to do with the environmental regulation. How will wastes be managed? What regulations are there to manage hospital wastes? Okay, who does the environmental impact assessment? Who approves it? And how fast can it be done such that you can set up a hospital? Because if you're going to set up a hospital, there should be an environmental impact assessment. See, what will the setting up of the hospital have on the environment? So how are you going to manage issues to do with waste, medical waste, sewage systems, and things like that? And where is the location of this hospital? Is it in an environment which is not safe? Is it in a swamp, or it is in a very good location? And then the legal dynamics, that is the last one, which is L. Okay, when you're going to set up a hospital or healthcare organization, where are you going to get the licenses, and what type of licenses are you going to get? And is the process very transparent, or it involves middlemen? Okay, or it involves you making sure that you get a person within the government to make sure that your process can be faster. So those are all dynamics to do with the legal framework within which the healthcare organization is going to operate. So that is PESTEL basically. Now we move to the other model, which is Porter's 5 forces. Okay, this is a model or framework that allows you to evaluate the different aspects of an industry. So if you want to open up a business, whether it is in healthcare industry, whether it is in the pharmaceutical industry, which can be part of the healthcare industry, what are the things that will guide your decision in entering that industry? So Michael Porter identified 5 areas that you really need to look at, which we basically call forces. So the forces include the threat of new entrants, that is one, and then bargaining power of buyers, the threat of substitute and of substitute products, bargaining power of suppliers, and then rivalry among us or among existing competitors. These are the 5 forces that can determine whether you can really enter into that industry or not. So whether you want to open up a hospital or not, these are the things that you need to look at. So we're going to look at each of these elements and be able to expound on them. So when we talk about competitive rivalry within the industry, you look at the number of hospitals around the geographical location where you're interested. How are they operating? So what is the competition? You can have hospitals, yet the competition is not stiff, and there is potential within that market. Okay, but you can also have a situation where you have the competition being intense in the industry, given the number of actors that are available. So you can look at the indicators such as market growth, fixed costs, diversity of rivals, and then how contracts are actually managed. Okay, if the competition is very stiff, you may not go full blown, like you don't blindly enter into this industry, but you may need to be very innovative and use strategies that are not being used by the actors who are already available in the market. You can also make sure that the services that you're offering are distinct and they are unique. Okay, or you can decide to actually serve a given segment of the market. Okay, it's like that your services are tailored to a given class of people within that geographical area where you intend to serve. Okay, so those are the things that you really need to look at. That is competitive rivalry within the industry. Okay, what are other people doing, and what costs do they incur, and what is the potential growth within that industry, given the number of competitors. Then we look at the threat of new entrants. Okay, with this, you look at how easy is it to have other key players coming in and then disrupting the market or causing market distortion or causing a disruption or causing a large shift in consumer behavior or completely distorting the market. Okay, so these are the things that you really need to look at. One is the common technology. What technologies are actually people using? The technologies that people are using can determine whether it is very easy to enter into an industry or not. And then you look at capital intensity. If, of course, the business requires a lot of capital, then it means that you're most likely going to have few entrants into the market. And then government regulation. If you have strict, what we call restrictive government policies, then you're going to have very few actors entering into the industry. But the other thing that you also need to look at is if, for example, what we call restrictive government policies is when it's not very easy to enter a given market, partly because you have government officials that are running the industry. I hope you understand that. You can have key government officials, influential government officials, who are running certain businesses, and then they make it extremely very hard for other people to enter into the market. To have what we call multilateral corporations entering into the market, because they are strictly restricting the entry into the business. And then you have brand identity. Okay, brand identity refers to your the reputation, the loyalty, the perception, all things that are related to your brand. Okay, is it very easy to have certain brands easily penetrating the market because of the brand that they have already gathered somewhere else? Okay, because the brand is built over time. Your brand identity is built over time. So it is very possible to have unique brands entering into the business or into the industry. But of course, seeing the other factors also influence how new entrants can enter into the industry. Okay, and then we have what we call startups, high cost or high startup costs. Okay, you can have a brilliant idea that you want to implement, that you change the healthcare industry, but you don't have the resources, the capital resources required to make sure that you can implement your innovation at a large scale. Okay, this one is actually also associated with the ease with which you can access financial resources. If you live in a country where if you have this brilliant idea and you want to scale it, you need to look for investors to invest into your business idea. But if you don't have the access to investors, or if investors are not willing to invest in your business because of where you're located, or because of the political dynamics, for example, being in a conflict area, it makes it extremely very hard. Okay, so it means that for you to survive in this environment, you need to be able to stand out in the crowd by having a unique brand that offers high-end or high-quality services or products. Okay, and that means that you need to strategically create partnerships and collaborations or alliances such that you really establish yourself, and it's very difficult for a new entrant to come in and then dislodge you from the market. Okay, so you really need to consolidate your market share. Okay, so that is very important. The moment you enter into a business, you establish, of course, you get clients. These clients become loyal to you, and when they become loyal to you, you need to consolidate that loyalty. If you consolidate that loyalty, it is very difficult for a new entrant to come and dislodge you. That's the point I'm trying to explain. And then threat of substitutes. Okay, if you're going to establish a healthcare organization, you need to be aware that you're going to compete with even non-profit hospitals or even public hospitals. So that means that you need to be very, very innovative, such that the threat that is posed to you by these hospitals owned by NGOs, hospitals owned by the government, such that they don't make you run out of business. It means you need to be able to provide services that actually the clients want in the way they want it. Okay, so differentiating or having unique healthcare services that meet customer preferences is very key. So we move to what we call bargaining power of suppliers. Okay, this is an element in our context that is to do with the supply chain processes that we have in the country. Okay, most of the medical supplies that we have actually imported from out. Some countries in Africa can make some of their medical supplies. Some countries, even Uganda here, makes their own ARVs, and some other drugs they make them within Uganda. I don't think there is any single drug that we make, any pharmacological agent, drug that is approved globally, that is actually manufactured in South Sudan. So that means that if you're going to rely on everything that's going to be imported, it means that you need to have suppliers who are very reliable, extremely reliable, to navigate even the logistical issues associated with medical supplies, issues to do with transporting them and making sure that they reach where they are supposed to reach in a good state. Okay, so that has to do a lot with what you call the bargaining power of suppliers. So it is very important for you to form partnerships and also and collaborations, and make sure that you have these partnerships and collaborations with reputable suppliers, such that you don't run out of suppliers, and then your reputation as a healthcare facility goes down. Bargaining power of buyers, of course, this is very important. The economic status of the country, which is basically, it trickles down to the people who are going to get services from your facility. What is their ability to pay for the goods? Are they even insured? If they're insured, then well and good. If they're not, then it means it's going to be out-of-pocket payments. So out-of-pocket payments are not really reliable. They're not reliable, and they can lead to what we call catastrophic expenditure. So you want to have clients who have a higher power or higher purchase power. Okay, but if you also want to really survive, you need to consider issues to do with customer loyalty, and then also targeting your services. Okay, so that was the Porter's. That was Porter's 5 forces. Okay, so we're going to move to another model of analyzing what happens within. Yes, a minute. Okay, so we have what we call SWOT analysis as another framework. So we have so far looked at 2 frameworks: Porter's 5 forces, and we have also looked at pastel model. So SWOT analysis, which I think most of you are familiar with, is to do with making sure that you understand the strength, weaknesses, opportunities, and threats to an organization's operation. So I will not really dig deep into this, but basically, when we look at strength and weaknesses, these are internal. Whereas if you look at opportunities and threats, these are things that are to do with the external forces that can affect the operations of the business. So I've highlighted some of the few things that you may really look at when you're doing a SWOT analysis for a hospital. Of course, this does not mean that every hospital will have this kind of SWOT analysis. So we move to what we call segmentation, targeting, and positioning. So having understood the environment within which the hospital or the healthcare organization is operating in, you really now need to put strategies on how to position yourself. Okay, what strategies can you really implement? So you can implement things like targeting and positioning and other things that we shall look at. But of course, on top of the things that we have looked at, there is one technique that you will need to look at. Okay, and that is basically doing a market research. Okay, and this is where you can now conduct interviews, conduct surveys. You can conduct them with the patients or even with employees of the organization. This is also another thing that adds more information to the status of the status of the organization. When we talk about the status of the organization, we are looking at what perception do people have about the organization, what image do they have. Okay, and this will tell you whether you have a very good reputation or not, whether you're meeting your mission or not, and that is very, very important. And we looked at this some time back. So let us start by looking at what we call positioning. Okay, you have many healthcare organizations, or you have many hospitals. What makes you different from others? That is, what makes you different from others is how you position yourself. So you need to establish a distinct and desirable image or perception of your healthcare organization, whether it is about the services that it offers, whether it is about the facilities that it has. You want to have this positive perception about everything about your facility in the minds of the target population or the target market or the target patients. It can also be about healthcare professionals and even the community at large. Okay, so this basically is to say that, you see, managing your reputation is very, very key. And if you treat your health workers well, then you have very good, well-talented, skilled, and competent workers coming and applying to your healthcare organization. If you have a bad reputation, then it is going to be very hard for you to even attract the health workers. And if you cannot attract the best health workers, it is very difficult to attract clients. And then the community will have that negative perception about the healthcare services that you provide. So that's why positioning is very, very important. Positioning does not come out of the blue. It relies on a number of things. Of course, the mission is very important. The mission is very important. It influences everything that the hospital actually does. Okay, so the nature of services and how the services are being provided is influenced by the mission. But to make sure that the way in which that mission is being executed in a unique way is something to do with positioning. What do you want the community and other key stakeholders to think about your services? what kind of mental image or perception do you want them to have about your services? That is very, very important. So if you realize that uh, uh, your position is not a good one, is not favorable, then you need to readjust. Okay, so that means you need to reposition. This is where you need to do, it's an issue to do with rebranding, changing the whole. It can be a partial or full restructuring of everything, including the services, the human resource, everything. Something that you really change and reposition yourself to be to meet the changing demands of the clients, and also to meet the dynamics of what is happening within the external environment. So that means that you need to be aware of what is happening. What are people saying about you as a healthcare organization? And are the needs that you're actually providing still relevant to the population that you're serving? That's why we say that healthcare organizations should be dynamic. Okay, so if you conduct this research, market research, and you discover that people are suggesting that you need to include these services, you need to do this, you need to do that, and if they give you a score in terms of the satisfaction, the scores are low and things like that, then you need to revisit what you're basically doing. So that is about repositioning. So why is it very important to position yourself? One, you want to be distinct. It's to say that you don't want to be like what all other people are. So you need to be unique. You need to have a unique identity. And then that actually has an impact on what people what perceptions people will have about the services that you offer. And of course, the perception influence their decision making, and then of course contributing to your success as an healthcare organization. Okay, so it means that you need to have these unique features that strategically place you in the minds of clients, so that they can have a very good interpretation of the value that you actually offer. So your value proposition is very key. And that means that you actually need to have deliberate efforts to make sure that you communicate this to the potential clients. Okay, so what strategies can you really use to make sure that people perceive you in the right way? One, the product attributes and features. Or even let's look at the services that you're offering. What are the unique standpoints of the services that you're offering? Are the services offered by experts or specialists, or you're relying on ill-trained health professionals? Okay, what technologies are you using? If someone goes with a health problem, how are you going to diagnose this health problem? Are you going to use the appropriate technology or outdated, inconvenient, painful procedures for a simple health problem? So you look at the quality, the technology, the convenience, the expertise used. So that is product attributes and features, or you can just say service attributes and features. How are people receiving services in your facility? That is one. It helps you to stand out. Okay, if I go with an eye problem, what is the waiting time for me to see an ophthalmologist or to see a general physician? Is it very convenient? I can call anytime and then within no time I can have my consultation, or it is very difficult. Okay, and then we have the value or the price. Okay, what are you going with? Are you offering services at below minimum cost, or you are targeting people who really have some finances, that and that is your target. A procedure that costs 20,000 in one another place, you charge it, you charge it 35. Okay, so that is a strategy that you can use to make sure that perhaps you are distinct from others. And then market segment. Okay, you may choose to work on clients that have specific health concerns, or it can be a children-friendly facility. It can be a maternity-friendly facility. It can be a geriatric facility. It can be a surgical hospital. It can be whatever it is. So for you, you have specific target groups. And then you also need to look at competitor comparison, positioning based on direct or indirect comparison with competitors to highlight advantages or differentiate yourself from them. Emphasis can be on issues to do with. For us, we have served for over 10 years. So if you have a hospital which has entered into the industry, let us say for the last 2 years, and then maybe it is bringing up a competition that you didn't expect. Maybe you may need to position yourself in terms of experience. See, for me, I've been in this industry for over 30 years. So that is where you want to place yourself. 30 years of excellence, 30 years of providing quality services and improving health outcomes. So your strategic point or your strategic positioning is related to what other competitors within the market are actually doing. And then the niche, which is basically to do with where are you going to specialize. Okay, the examples that I gave, whether it is a dental clinic or ophthalmic, an eye clinic, whether it is a gynecological clinic, whatever it is, that may be your unique positioning strategy. So before you decide to position yourself, before you decide to choose the image that you want to portray to your potential clients, you may need to look at the following. One is market research. You need to understand what people are saying about your healthcare organization. So what are the preferences and the needs and the perceptions of your clients? Identify the gaps in the market, and then see how you can align the opportunities within the market together, taking note of the differentiation that you want to undertake. And then two, you need to look at what we call the unique selling proposition. Okay, what is that unique and compelling service or product that sets you apart from others? Okay, what is that unique thing that your hospital has in comparison to others? That is what we call the unique selling proposition. The other thing that you need to look at is how you are going to align your positioning strategies with the overall brand image and messaging. Okay, and also don't forget the mission, the brand imaging, and the messages should be aligned. They should be aligned. It should be a deliberate process of you making sure that you have a positive messages coming out of your healthcare organization. Okay, and then consistency and differentiation. This is very important. If you just keep changing positions, then it becomes extremely very hard. So you need to be consistent in positioning across the major touch points and marketing channels. And then, of course, you need to continuously see what messages are coming back to you as in form of feedback. This is very, very important in making sure that you make readjustments as needed. Okay, so the other thing that you need to look at is what you call the market matrix. These were basically the four P's of marketing, where we look at the product, price, place, and then promotion. Okay, the four P's of marketing, these are the ones, and they are basically self-explanatory. What are you interested in? What products are you providing, and at what cost? Okay, and where can people get your services? What channels, what location, logistics, and what partners do you have? And then the promotion, which is the last P. We have other P's. So we can have what you call 7 P's of marketing. So with the 7 P's of marketing, you have the first four that we talked about. So we add people, processes, and physical evidence as the other 3 P's. Okay. So the other 3 P's, people, it's about the employees, service representatives, their skills, attitude, and customer interactions. And then the other P is process, is basically to do with the systems and procedures for delivering the service. Is the process very efficient, effective? Okay, or what is the customer's experience in receiving services in your facility? That is the process. And then you have the physical evidence, tangible elements associated with the service, the facilities. If you visit the health facility, what is the nature of the facilities there, the waiting place, the technologies used, the x-rays or the laboratory techniques and things like that. These are very important. Now, having understood these dynamics, now you need to implement. You need to implement the strategy, having gathered all this information about the healthcare organization. How do you want to proceed? Okay, so we can categorize the major marketing strategies into 3: survival, defensive strategies. You can have what we call concentration strategies, and then we have collaborative or cooperative strategies. So survival or defensive strategies, there's focus on internal restructuring, cost control, collaboration, or merging with similar hospitals. So to do this, you need to do the cost-benefit analysis of the services and prioritize where you can actually perform better. Okay, eliminate services that are not bringing revenues. Okay, such that you can have what you call cost optimization, resource optimization. Okay, and profits. So concentrate where you are doing well, and then just a minute. All right, it looks like I had gone off, but let's just continue. Okay, so the other strategy are the concentration strategies that you can be implemented. This is to basically establish a niche or look at what the clients are interested in and see if you can only concentrate on those services. And then you eliminate the other services that are not giving the results that would be expected. So we move to what we call collaborative or cooperative services, strategies. With this, you want to work with other entities to make sure that you expand your reach and then enhance the marketing input and improve patient outcomes. Okay, so you work together with other hospitals. So you can do what you call partnerships and co-branding. With co-branding, you're basically interested in creating mutually beneficial alliances to enhance brand recognition, leverage each partner's reputation and cost base and customer base. You can do cross promotion where you have you market or promote complementary healthcare services or products through joint marketing efforts. So you can run adverts where you have two entities or healthcare organizations running the same advert, and each derive benefit from that. And then you have shared resources and expertise. This is where you can share stuff within with the two entities or even more entities. It can be staff, it can be technological abilities, it can be marketing budgets. You can have you can run campaigns in a joint manner. Okay, this also is very important for issues to do with cost cutting, but also generating mutual benefits. Okay, so these strategies are very important in reducing costs, and therefore all parties in these partnerships or collaborations benefit. Okay, so there are many marketing programs that you can really run. It could be you offering a unique product, which we talked about in the different P's. A unique product in a unique place, that is in geographical location, how you're going to distribute it, whether you're going to have other centers in other places, issues to do with pricing, promotion strategies and things. These are part of the strategies that you have to implement. So lastly, we're going to look at having done the analysis, having chosen all the strategies that you want to implement, you can now finally look at what the marketing plan, that is basically write the marketing strategy that you have. So you write this marketing plan or marketing strategy for this hospital or healthcare organization. It will have the executive summary, which is a concise overview of the entire marketing plan. And then it will have a section on situation analysis. This is basically information to do with what you have gathered using the different models, the SWOT and then PESTEL and others. Okay, and then you need to outline the marketing objectives, what you want to achieve. So you'll have a number of measurable or SMART objectives. Okay, what do you want to target? It is to do with positioning, segmentation, things like that. And then the strategies that you have to undertake. Are they survival strategies, cooperation, or concentration strategies? Okay, and then now you will have an implementation plan. What specific actions will be undertaken, and then what are the time frames? Who is responsible for what and what resources are needed? So the budget has to be written and has to be very, very, very clear. And then the last part is to do with the monitoring and evaluation. So you need to have clear metrics. Okay, that is, the metrics should be aligned with the objectives of the campaign. They should be measurable. Okay, they should be measurable, and you should be able to track these metrics that you have. The metrics can be qualitative or even quantitative in nature. Okay, so you can also look at other outcomes to evaluate the effectiveness of healthcare marketing. You look at issues to do with financial outcomes, operational outcomes, even patient-related outcomes. Okay, so the key performance indicators that you can really track include the patient acquisition, the number of patients that come as a result of marketing campaigns, how much revenues you generate, and then patient satisfaction. These are things that you can really track. And then lastly, the brand recognition. Okay, it is very important for you to consider looking at data analytics in tracking these key performance indicators. So that marks the end of this presentation.